Hey, Mike Gibson, Christie Ballantyne, and we're talking about enlicitide, a new oral PCSK9 inhibitor for heterozygous familial hypercholesterolemia. Christie, talk to us about what you did and what you found.
So, Mike, this is the coral reef heterozygous FH study. There's a program, the phase 3 program for enlicitide. It's an oral macrocyclic peptide, inhibits the interaction between PCSK9 and the LDL receptor in a very similar manner to the monoclonal antibodies. So it's not really a small molecule. It's a pretty cool story about how it was developed. They screen
Well, they
this.
said it wasn't druggable, Christie. They said
Yeah, they
it.
said it wasn't druggable. That's the part that's, I've been in consulting like a decade ago, and they said you'll never make a small molecule. So they screened this RNA display macrocyclic peptide library, 10 of the 14 molecules. So that's kind of where biotech comes in. They identified something that inhibited this interaction, and then they did this amazing clinical chemistry to make that into something that can be a drug. The issue of avoiding proteolysis and digestion in the stomach, and then not interacting with the P450s and everything else. So this was the phase 3 program. The phase 2 program had suggested that you could get about a 60% reduction. This was testing a 20 milligram dose. It's taken once in the morning. And one of the things that was is important, this was a 1 year study. So, the short-term phase twos, this was a 12-month study, and it was very reassuring that, in fact, you can get the 60% LDL reduction and that it persisted through the year. And it wasn't really a problem about taking it fasting. So I think that's what the highlights. The other thing that comes up is you get really good reductions in non-HDL cholesterol and ApoB. So the non-HDL cholesterol reduction was 53%, ApoB was 49%. And that's been one of the things that we see you do really well with and this is on top of statin therapy, high intensity statin therapy, about 80%. Two-thirds were on ezetimibe. So
Hmm.
on top of those good therapies, you got this additional reduction. So very reassuring. One thing I always look at is when you look at discontinuations due to AEs in terms of drug tolerability, and it was 2% for the inositide, 3% for the placebo. So always nice when you see that it's the same as the placebo. This was numerically lower. So quite encouraging. A similar trial was done in high-risk individuals, a bigger study. This was about 300, that was about 3,000. Very similar results for 1 year. So two nice lipid studies. And then there's a fully enrolled outcomes trial that's ongoing.
Wow. When will we see the results of the outcome study?
It's going to be a while. One of the things I think we saw out of Vesalius, which was, the last meeting was an important one for PCSK9s because the Vesalius study was longer. They really were too short on the first one. 4 year was 2.2 million years. Vesalius, you get it out over 4 years, and now you're seeing the 25% reduction in hard endpoints, CHD death, MI, stroke, 3-point MACE, which is more like we thought we'd be seeing with these drugs for instead of 15%, and which was really striking. By the hierarchical testing, it didn't make CHD death, but it made total mortality 20% reduction. So we call it a nominal, but if you've ever been on a DSMB, one thing you don't get wrong is dead or alive. It's not that easy to determine the cause of death, but so encouraging that in terms of the role of these. That was a high risk population. They didn't had not had events. Most of them had some kind of vascular disease, high CAC score, or diabetes with other risk factors. But it's encouraging to see that we may have another option here with an oral molecule. And so that trial is going to also go longer to make sure it looks at this the same way. It'll be 4+ years median duration.
Yeah, I like it when they go longer because you have maybe a constant relative risk reduction, but you have bigger and bigger absolute reductions when you go
Correct.
longer. So, Christy, congratulations. Good to see another option out there. Thanks for joining us.
Thanks, Mike. Always a pleasure.
Great.